Joining me now live is the Premier of New Brunswick, Blaine Higgs. Hi, Premier Higgs. Good to see you as always. Thank you for making the time.
You're very welcome. This is Vassy?
It is Vassy, yes. Premier, your
right.
counterpart in Manitoba. Your counterpart in Manitoba, right. Premier Stephenson, told me a few minutes ago that she was a little disappointed by the sum of money put on the table by the federal government. Would you agree with that assessment?
Oh, yes, I would indeed. It wasn't what we expected, for sure. Wasn't what we'd hoped for. But at least we have an offer on the table, and that's more than we've had for the last 2.5 years. So you gotta look at it as a win in that regard.
So the last time we spoke, I think I interviewed you just a few weeks ago, and I had told you that Minister LeBlanc, indicated that it wouldn't be $28 billion per year on the table, but it wouldn't be a small amount. You had said at that point that you didn't expect $28 billion. How far off is the amount today presented from what you did expect, though?
Oh, I would expect about 10 million or 10 billion. I was expecting a fair amount more in this sense. But I guess it is what it is. So we need to regroup and think about, okay, is there more here in this regard? Maybe there wasn't any indication there was really a negotiation to be had, other than working through the bilateral agreements. And I think I am encouraged in relation to the items that are on the table there to focus as priorities. We have no trouble with that. I've said that many times about I believe we should be measuring outcomes, and we should understand best practices throughout our country and whatever country, because I think what this is saying to us is, okay, you're not going to get the money that you wanted. You're going to have to look at how you fund healthcare differently. We're going to be forced to do that. And but one thing that we cannot do is have less of a service delivery. In fact, we need a higher level of service delivery to the patients and the people in our province. So we have to have better healthcare. So with the money that we have to find a way to do more and do better, and that'll be the goal. And I guess collectively, if we can learn from each other, and the next steps after we decide what do we do with this particular offer, then we focus on the big picture and delivering better results.
Premier, I know your time's limited, but I'm just trying to read between the lines here. I get the sense from you don't think that the federal government is prepared to come back to the table with a lot more money. Is that accurate?
Well, we didn't get any indication that would be the case. That's very true. It was pretty well, here it is. And I think that's been quite traditional over the years with federal governments to the provinces. Here's what we're providing, and so there you go. But in this case, a little different, because the bilateral agreements can yield some kind of different views on what works for each province. And I think in our case, Atlantic Canada, there is an understanding that we do have an aging population. Healthcare costs are higher per individual. And in our bilateral agreements, I'd like to think that we can look at that for the reality that it is, and be able to negotiate something there that works.
At the same time, that bilateral agreement, the proposal includes a cap, right, for how much all of them will be worth, $25 billion. You don't anticipate getting more money through the bilateral, just being able to negotiate the conditions, right, the specifics of it.
That's correct. Yeah, that's correct. I think that in that recognition that we have some flexibility there to focus on what really is important for us in our respective province, and in our case, New Brunswick.
What does it say to you, though, that the premiers aren't able to counter and effectively be able to access more money? Like, why is there such a discrepancy, do you think, between what you expected and what you ended up with?
Well, I think, I guess I would point that there's always been a concern with me that this turns into a bidding war between provinces. It turns into a situation where we're challenging each other on wages, and then we're just kind of not improving healthcare, but we're just kind of developing a whole different, well, you did this, I'll do this, and that's not going to generally improve healthcare across the province or across the country. And I guess personally, I'd rather be focused on what are the standards that exist across the country, where do we have shortcomings, and then how do we help all provinces and territories reach the level that's acceptable for a Canadian healthcare system, which we cherish, but know has some deficiencies from what we've experienced over the last few years. And looking at the ability to get more people in the system, You know, we need an immigration policy that actually, maybe like it happened during COVID when the federal government really got geared up and they looked at, okay, I need healthcare professionals. I need to work with countries that have certifications that are the same or very close to what we have an expedited certification program so we can get people into the system on maybe a per capita basis, on a needs basis of where we see maybe shortcomings in delivery service. I just think there's an opportunity here to really get focused on best healthcare and then decide from that, do I need more money to do that? Or is that where I can focus the money I have? And that's going to be a challenge we're really put into that box because we've seen a limited increase here at this time.
Okay, I wish I had more time, but your staff is telling our producer you got to go to catch your flight. So Premier Higgs, I'll leave it there. Thanks very much for your time.
You're very welcome, Vassy. Take care.